Excessive eye discharge 1 month after eyelid suture method. I just did double eyelid surgery method 1 month ago and also fat removal. My eyes were a bit of the dry type before I did the procedure. My eyelids now are getting more natural. But my eyes now easily produces eye discharge, especially when waking up and using soft lens. I noticed that the mucus may come from the upper eyelid. When doing activities, mucus isn't produced that much. Sometimes I also feel a bit of a burning sensation. Why? How to cure this?
Thank you for your question. You submitted your question with two photos. So you stated in your question that it is now 1 month after you've had Asian eyelid surgery using the suture technique, and you did have some fat removal. And you state that you did have some dry eye before surgery, and that you're noticing this mucus discharge every day, particularly in the morning, and you wear soft contact lenses. And so you're asking about what is going on. Well, in the absence of a physical exam, I can certainly share with you how I counsel my patients preoperatively and postoperatively, particularly those who wear contact lenses. A little bit of background: I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. Asian eyelid surgery is something I perform fairly routinely, both incisional and non-incisional, as well as non-Asian eyelid surgery to help people improve their eye appearance, whether it's upper lids, ptosis, extra skin, or under eye bags. So, and having an ophthalmology background certainly has worked to my advantage in guiding patients who also have concurrently dry eye. So to begin with, it's very important to understand that even though you have a little bit of dry eye before surgery, you are probably capable of producing enough tears to be able to tolerate contact lenses, which is a good thing. Well, one thing to understand is that it is not unusual to have some degree of dry eye after eyelid surgery. When you are working in the eye area, even though you may have no problem with eye closure or anything dealing with exposure, it is typical to have some degree of decreased tear production after eyelid surgery. So I explain to my patients who already have dry eye, if they're not contact lens wearers, I tell them to use liberal amounts of artificial tears, both before surgery and after. And I tell them to use the artificial teardrops with meals. That way it's easier to remember. Breakfast, lunch, dinner, and then bedtime. This way, at least they're getting drops to help lubricate the eyes. Mucus production can be a reflection of that dryness and an increase in relative friction between the eyelid and the contact lens, and your body produces more mucus as a way to help compensate for the dryness. The other possibility that I'm sure you and your doctor should, if you haven't already checked out, is that when you do suture technique or non-incisional Asian eyelid surgery, it is pretty much the norm to place a suture from the outside, flip the eyelid, and pass it through to the surface that is over the eye, and then pass the suture back. Now what that means is that there could possibly be the relatively low risk of a suture exposure, but it is something that when you're doing this surgery, you pretty much make sure isn't the case. Essentially, the technique of non-incisional Asian eyelid surgery, when you place the stitch going through, you put the suture back into the same opening or in basically the same area, such that it's unlikely, and especially after the sutures are tied, it's very hard for those sutures, unless they get exposed or unraveled, to actually ever touch the eye. So it's very rare. But just to make sure, it's good to have your doctor check that out. Generally speaking, if there was a suture that was touching the eye, you would feel it and it would be extremely uncomfortable. It seems more likely that this is just a reflection of the relative dryness associated with eyelid surgery. And so my contact lens wearers, I tell them to use lubricating drops liberally. Now for contact lenses, you always need some type of drops that are specific for contact lens wearers. Otherwise, I would say that just periodically, depending on how you feel, you may want to take a break from the contact lenses as the tear production for your eyes goes back to normal baseline. So discuss this with your doctor, or discuss this as well with your eye doctor to just make sure you get the optimal lubricating regimen done so that you can really get the proper lubrication of your eye surface. And as the months go by, these symptoms should improve. So I hope that was helpful. I wish you the best of luck. Thank you for your question.